कि सर पे टोपी है, मत कहो कि सर पे टोपी है, कहो सर पे हमारे ताज है, कहो सर पे हमारे ताज है, ये चमन हमारा अपना है।
Cost is quite significant. Actually, if you consider the total cost from the point of view of the medical supply, hospitalization, and then after that you have to buy some devices so that you are able to do things which you were able to do before, but many times you can't. Then you have to hire people to do things which you used to do before, and minor home repairs, lawn cutting, snow shoveling, any kind of thing is screwing something. So much so even changing the bulbs, that becomes very difficult. So इस सब की वजह से इसका काफ़ी प्रॉब्लम हो जाता है. और 2018 में कनाडा में फॉल्स का कॉस्ट था वो $5.6 billion. So that was a very significant cost, and that amounted to 20% of all the costs incurred by different types of injuries. फॉल्स के causes क्या हैं? फॉल्स के external causes हैं, internal causes हैं, behavioral causes हैं. There are 3 categories. अब हम सब पे थोड़ा थोड़ा संक्षिप्त में बताएंगे. तो external causes में 3 चीज़ें हैं. एक तो slipping and falling, दूसरा tripping and falling, तीसरा falling from a height. So slipping is आज के मौसम में बाहर बर्फ़ पड़ी हुई है और सड़क जो है वो स्नो और आइस में चिकनी हो जाती है, तो पैर फिसल जाता है, लोग गिर जाते हैं और गिरने पर चोट लगती है. इसके अलावा जो है अगर घर में कोई वेट सरफेस है या ऑयल स्पिल है और या बाहर कोई बनाना पील पड़ा हुआ है उस पर पैर पड़ गया केले के छिलके पे तो भी you go flying and you fall. So that is the slipping part of it. And the second cause is tripping. Tripping means कहीं ठोकर लग गई आपको तो तब उसकी वजह से आप गिर जाते हैं. लेकिन क्यों गिरते हैं? पॉइंट इज क्यों गिरते हैं? स्लिप करने से या ट्रिप करने से? स्लिप कर एक्चुअली बैलेंस बना हुआ होता है उससे कि आपका जो टोटल वेट है वो दैट इज an imaginary point you consider center of gravity somewhere in the middle of the hip bone. अगर उस पे अब ये देखिए मैंने बैलेंस किया है इस पेन को उंगली पे. So it is the center of gravity is being supported by the area of support. जरा भी इधर उधर होगा तो गिर जाएगा ये. तो स्लिपिंग में यही होता है कि आपका सेंटर ऑफ ग्रेविटी इज सपोर्टेड बाय द बॉडी, लेकिन जहाँ आप स्लिप करते हैं तो आपका एरिया ऑफ सपोर्ट जो है आगे बढ़ जाता है, सेंटर ऑफ ग्रेविटी पीछे रह जाती है एंड देन यू फॉल. सो दैट इज द रीज़न. ट्रिपिंग में क्या होता है? इस बिट ऑपोजिट ऑफ दैट कि ट्रिपिंग में ठोकर लगी तो पैर तो रुक गया बट यू हैड अ मोमेंटम ऑफ वॉकिंग और रनिंग, यू वेंट अहेड and then you fall. So then what happens that the center of gravity goes outside the area of support. Slipping में this area of support moves out of the center of gravity, but tripping में it is the other way around. और tripping hazards काहे के होते हैं? कहीं irregular surface है. अब I will give you an example of myself. In Chicago, I was visiting my son and his family, and we decided to go for a walk. And sidewalk पे walk कर रहे थे. My wife and my son, they were walking ahead of me, and I was a little behind, just a few feet behind. और sidewalk पे you don't expect any kind of obstruction. उसमें जो था वो somehow they had made 2 inches wide and 2 inches high speed breakers, and there are several of them, one after the other. They were, and I was behind them. I was looking at their backs, and I was looking different direction. I wasn't looking at the road, and I tripped and fell, and then I broke my rotator cuff of my right arm. उससे अभी तक I'm suffering. So that kind of a thing happens. And another, I have had to, I was asked to consult on several cases of fall or tripping fall, in which एक आदमी तो यहाँ पे टोरंटो में condo dweller, and at the main floor, reception floor, there was a square, carpeted square, and along the side there was tiled surface for walking. He was coming out of that, लेकिन corner में वो the carpet was folded, so एक fold, थोड़ा सा fold निकल, उसमें वो trip किया, a senior man, and he fell down, and then he broke his hip bone, and he was hospitalized, and that became his disability, and in the matter of 8 months he passed away. So those kinds of things happen. The another thing, in one of the young physicians, ophthalmologist, he was going to his hospital for to the clinic, and he entered the hospital from a different entry which he was not familiar with. वहाँ पर construction हो रहा था. Construction में there was a, at the door sill was a little raised, and he didn't realize, and he tripped on that, and as he was coming to that place, it was a small area, and after that there was another wall. So after tripping, he just went forward kept on staggering and went forward and hit his head on the wall. उनको बड़ा severe concussion हुआ, and after that he could never get back to his practice, and he was disabled, so he could not practice his profession. So these kinds of things happen, and if there is a clutter or there is anything which you do not expect, you can trip on that. So those are the external causes. Internal causes mein age is a big factor, which means we all have a big risk factor, that is age. And with the age, what happens? Other problems come. Like some people may have high blood pressure, low blood pressure. Low blood pressure may suddenly blood goes to the lower part of the body and the brain say blood drain kar jata hai, then suddenly you lose the sense of balance and you fall. And diabetes, heart disease, vertigo. Another thing, eyesight and hearing problem. Those things also become a factor, because if you did not see properly, then you can trip on it. And blood vessel narrowing, which happens due to old age, that is one of the causes of increasing the blood pressure. That also creates a dizziness in people. Another issue which we have talked about before, the dementia. Dementia is also a risk factor, because if you are not very clear on what is around, then you can trip on it and fall. Behavioral causes में जो है वो footwear is very important. क्या जूता पहन रहे हैं आप? It is very important. If you wear a leather sole, leather heel shoe, you walk on the wet icy surface, snowing surface, you are most likely to slip and fall, and especially if you are taking longer steps. क्योंकि स्लिपिंग के लिए मैंने बताया ना आपको कि एरिया ऑफ सपोर्ट जो है it goes farther away from the center of gravity, and if you slip, that's how you are going. Your center of gravity is left behind and your area of support moves, then you fall. So it is important that you make sure that you are wearing a good footwear which has good grip, and many times, आजकल तो और भी ऐसे जूते आ रहे हैं जिनमें कि winter boots में their soles and heels are studded with certain kind of crystals which create a friction. Or slipping generally happens because the friction is overcome. So I was going to talk about friction as well. अगर कोई फ्रिक्शन मेजर किया जाता है कोएफिशिएंट ऑफ फ्रिक्शन से. Coefficient of friction, the lower the coefficient of friction, the higher the slippery surface. So simply to explain it to you, कि अगर मैं 1 किलोग्राम वेट यहाँ पे रख दूँ और मैं उसको पुश करना चाहूँ, और अगर it takes 1 kilogram force for me to push it, then coefficient of friction is 1. और अगर मुझको 500 ग्राम में पुश कर दूँ तो कोएफिशिएंट ऑफ फ्रिक्शन 0.5, 200 ग्राम में कर दूँ तो 0.2, और आइस वगैरह पे उसका कोएफिशिएंट ऑफ फ्रिक्शन 0.03 और 0.1 to 0.3 होता है, which means it is 100th of the force, a tiny bit of force and you will slip. So the slippery surfaces are really big hazards. Other problem, behavioral problem, if you are running and your step gets further than what you intended, then that can happen. And if you have missed a step again, then you can fall. So, and if you are in a hurry to go, at our age, we can empathize with the idea that many times we have to hurry to washroom because the sense of urgency is so great that we don't want to leak in our clothes. So that is an issue. So therefore what we need to do that you don't have to wait till the last minute, but one can attend to that problem sooner. So what is the consequence of fall? There are several consequences and थोड़ा सा यहाँ पे scientific content होगा, but I will try and explain it in very simple and easy to understand terms. I hope it's not a problem, but if it is a problem, please let me know. And so पहला प्रॉब्लम जो पहला माइनर इंजरी होती है वो पुल्ड मसल की, मसल पुल हो गया. तो क्यों पुल हो गया, उसका क्या मैंने व्हाट डू यू मीन बाय मसल पुल? मसल इज ए फाइबरस टिश्यू. वो मसल फाइबर्स, most of us are vegetarian, but those who are non-vegetarian, they would know that the muscle has fibers, and these fibers are such that उनको आप समझिए जैसे ये उंगलियां हैं, these are fibers or these are segmented, कई तो segment हैं, and these segments are in each fiber. The segments are arranged end to end so that लंबा होता चला जाता है. Okay. Furthermore, each cell, ये कई सेल हो गए जो कि एक लाइन में लगे हुए हैं तो लंबा फाइबर बनाने के लिए. अब हर सेल जो है उसमें तो प्रोटोप्लाज्म है, लेकिन उसके सेंटर में एक मसल की मैकेनिक्स बहुत इंटरेस्टिंग है, बट आई एम नॉट गोइंग टू टेल यू द ऑल द फिनोमेना. बट उसमें सेंटर में एक मोटा सा फाइबर पड़ा हुआ होता है, और द टू साइड्स में जो सेल के एंड्स हैं, मेम्ब्रेन्स जो है, उनसे 6 पतले फाइबर्स निकलते हैं जो कि स्लाइटली ओवरलैप करते हैं इस मोटे फाइबर्स से. तो जब मसल कंट्रैक्ट करता है तो ये पतले वाले फाइबर्स उसमें क्रॉल करके और सेंटर की तरफ जाते हैं. तो दोनों तरफ से क्रॉल किए तो सेल छोटा हो जाता है, और सभी सेल जब ऐसे किए तो पूरा मसल छोटा हो गया. इसी वजह से जब आप ऐसे करते हैं बाइसेप मसल दिखाते हैं, बिकॉज दोज cells have contracted and the muscles have gotten tighter. Or muscles can contract to 50% of their original length. इसीलिए आपने जब आप जिम वगैरह जाते हैं तो एक्सरसाइज करने के बाद बताते हैं जो ट्रेनर्स हैं कि स्ट्रेच करो, स्ट्रेच करना ज़रूरी है. Why it is important? Because by stretching, what you are going to do is to lengthen your muscle so that you have greater contraction power. I don't know if it is making sense, but that's what happens. So, अगर जब आप स्लिप करते हैं, then you have lost control of your body mechanics, और मसल जो है वो पुल कर दी जाती है, पुल हो जाती है, and therefore it has gone beyond its length. Therefore, it has injured either the cell membrane or the fibers which were like a ratchet, जैसे चेन और उसमें ratchet होता है, उस तरह से होने के बजाय पुल आउट हो गया. तो that is pulled muscle, and it takes a few days to a couple of weeks for pulled muscle to heal, especially because it has plenty of blood supply and that kind of thing. दूसरा प्रॉब्लम क्या होता है कि जॉइंट्स जो हैं they become sprained or strained. जैसे मोच आ गई तो कहते हैं मोच आ गई, तो क्यों मोच आ गई? जॉइंट्स जो हैं, जितने बॉडी के जॉइंट्स हैं, they are stabilized by a special kind of tissue which is called connective tissue and is made of a special protein which is called collagen. अब collagen भी फाइबर्स होता है, और इसके फाइबर के अरेंजमेंट बड़ा इंटरेस्टिंग होता है. होता क्या है कि हर फाइबर में कई सेगमेंट होते हैं, और ये सेगमेंट्स जो हैं वो स्लाइटली ओवरलैप करते हैं एक दूसरे से, और वो स्लाइटली ओवरलैप ही नहीं करते हैं बल्कि दे आर कनेक्टेड टू ईच अदर एट दैट एंड। और यहाँ पे जब तीसरा होगा उसमें थोड़ा कनेक्शन होगा। तो इसेंशियली क्या होता है, जब जॉइंट को मूव करना होता है तो ये these connections pull and therefore there is slight motion and it allows the joint to move, and this movement is only about 10% which the joint can move because of this supporting tissue of collagen. So if the tissue is pulled apart more than 10% of its initial length, then it gets strained or sprained, and that is this sprain और जो मोच आने की बात हो गई। उसके बाद ये बहुत टाइम लगता है इसको हील होने में, बिकॉज इट इज़ नॉट एन एक्टिव टिश्यू, और इसका मेटाबॉलिज्म और इसके जो है रीमॉडलिंग होती है, और रीमॉडलिंग तब मोर इफेक्टिव होती है जो है व्हेन यू आर asked to move your joint. अब यही वजह है कि सर्जरी वगैरह के बाद डॉक्टर्स कहते हैं कि no, not bed rest, get up and get going, do some movement, simply because these remodeling of the collagen tissue or remodeling of the connective tissue and getting the strength back is as a result of the area where there is more stress. That's where there will be more deposition of these tissue, and therefore there will be more renewal and repair of those things. हमको और तीसरा स्ट्रक्चर जो है वो बोन है, बोन ब्रेक हो जाता है। तो बोन इज अगेन वेरी इंटरेस्टिंग। बाहर से तो लगता है जैसे एक लकड़ी से पड़ी हुई है, बट इनसाइड इट इज वेरी कॉम्प्लेक्स स्ट्रक्चर, और उसमें इट कैन बी ब्रोकन several ways. There can be compression fracture, उसका मतलब बोन को क्रश कर हो गई। दूसरा होगा कि अगर बोन जो है वो ब्रेक हो गई, वो टेंशन में ब्रेक हो गई, जैसे कि अभी हाथ यहाँ पड़ गया और यहाँ पे पड़ दूसरा सपोर्ट है, बीच में लोड लग गया तो बोन बेंड करेगा और टूट जाएगा। तो दैट इज टेंशन फ्रैक्चर। तीसरा तरीका है बोन के फ्रैक्चर होने का, जो कि डॉक्टर साबरवाल को हुआ था। वो कह रहे थे कि हम जरा सा ट्विस्ट किए और उसी में फ्रैक्चर हो गया। दैट इज स्पाइरल फ्रैक्चर। सो एंड दैट वाज अ हेयरलाइन फ्रैक्चर। सो उस तरह का फ्रैक्चर। फिर देयर आर मल्टीपल फ्रैक्चर्स, जबकि बोन के टुकड़े टुकड़े हो जाए। एनीवे, हाउ विल आई डू इट? So, what can we do? Falls होते हैं, there are hazards out there in the environment, and accidents do happen. One can slip, one can trip, one can fall. Some people of जैसे हमारे एक close friend है, उनके father जो है वो बल्ब चेंज करने जा रहे थे। He was in his late 80s, और वो स्टूल पर लाए, पहुँच नहीं पा रहे थे, स्टूल लाए, उस पर खड़े हुए और जाकर चेंज कर रहे थे। He lost his balance, fell, he broke his hip, he was hospitalized, and after a couple of months, complications arose. He had pneumonia as well, and eventually he died. So we need to prevent falls as much as possible, because that fall may start or kick start the deterioration of health and major problem for your life. So it is essential that you take care of it. So prevention में you have to build. Unfortunately, I come to the same conclusion most of the time, that in order to prevent your falls, you have to strengthen your muscles, you have to strengthen your bones, and of those what you can do by exercise and good nutrition. And try and not get obese. Obesity is a big problem because that comes with other complications, diabetes and other things as well. So, and in order to do that, you have to continue to exercise, and it is suggested that minimum is 30 minutes per day to roughly 150 minutes per week. अगर आप exercise करते रहें, then it will keep you in shape and fit, so that you can prevent what is called sarcopenia. Sarcopenia is muscle degeneration and loss of muscle. Biological tissue में यह है कि use it or lose it. अगर आप नहीं संभाल करेंगे तो there will be you will lose them. So muscle atrophy happens very frequently if you are not doing any muscular work. Therefore, it is important that you continue to do exercises. And in order to develop the strong bones, you have to do weight-bearing exercises, walking, jogging, running, these kinds of things, as well as weightlifting and those kinds of things in order to develop the strong bones. So you develop the strong bones, the strong muscles, and alongside then you get additional benefit, and that benefit is that of sharp reflexes, so that you have better control of your body and you don't really fall victim to the kind of thing which that area of support sliding away from you, or area of support remaining behind the center of gravity. So all those things will not happen. A prevention method, then you have to also consider that sleeping के लिए तो मैंने बताया आपको कि footwear is very important. You have to pay attention to footwear. It must be non-slip, non-escape kind of thing. Or try and make your home fall-proof, and that is to say also that some specific things, like agar stairs हैं, there must be railings on both sides of the stairs so that आप पकड़ के उससे उतर सकें, चढ़ सकें. Or your living area or wherever you are going, it should be well lit. Light में कंजूसी नहीं करना चाहिए, because if you don't see, then you can trip and fall. And install grab bars in your shower. Shower में काफ़ी लोग गिरते हैं, shower या bathroom में, because people slip with a wet surface. Remove clutter from the floor and remove slippage agent. Don't allow any oil to spill on the floor, but if it does, then you wipe clean and make it better again. Behavioral factors में आपको क्या prevention कर सकते हैं? That you must always get your eyesight and hearing checked, so that you don't have any deficiency in those things which can become a major issue in order to maintain your balance. Or exercises में yoga is very good. Yoga, Pilates, Tai Chi, for flexibility and balance, and those kinds of exercises are good. Do weight-bearing exercises for bones, and do muscular activity, muscle weightlifting and that kind of thing to prevent sarcopenia, so that you don't lose any muscle. But falls do happen, and if it does happen, then what do you do? पहली चीज़ तो यह है कि you stay there. First of all, don't panic. Don't panic. Stay there. Breathe. Deep breathing, and then you think and decide what you need to do. Assess the situation. If you can, then crawl to a safer place, or else you can get on force, और उसके बाद maybe you try to get up. If you can, then you call for help either by calling somebody at home, or if there is nobody, then dialing 911, carry your cell phone with you, and or if you have the alert button on you, then you can push the alert button and somebody will be there to help you. So this is how you can manage your falls. So as Dr. Sabarwal had said that I should leave 15 minutes for
Yes, but
questions.
question answers. Question answers.
Yeah,
I
so
think
I'm
normal.
giving
Yeah, no,
more.
I think.
Because I
Question.
was going to talk about the structure of muscle and ligament.
We'll
and
continue,
all
we'll continue.
that, but-
We'll continue.
And bones, but I cut it out simply in order to keep it short.
Yes. Question answers in case any, particularly I would like to. Yes, yes.
I have a question.
बोलिए.
I
Please.
had a muscle problem 2-3 weeks ago. And
Stand up.
I went to emergency as well as I went to see my family doctor, or there was no family doctor, there was a walk-in doctor.
Right.
Why didn't my doctor, any of those, prescribed any muscle relaxant? Are they I mean, either they are scared to write a prescription or they are not competent to write a prescription. That's my question.
Yeah.
Because two doctors, finally, somebody suggested me from India that if you have an MR at home, try that. And luckily we had some expired MR from India. And I took it 5-6 days. In combination with the exercises and muscle relaxant, I was able to recover my normal life. So my question is, why doctors are not even looking into that? Are they incompetent or are they scared to do that?
No, no. यहाँ का model जो है, medical model is very different. They treat a condition, and the muscle relaxant is, they consider is not needed. But essentially, as you said, it is a good idea that if you are having pain, then of course they should have prescribed you NSAIDs. NSAID is a non-steroidal anti-inflammatory drug, which is like Advil, Aleve, these kinds of things. They will relieve your pain and they will decrease the inflammation. And then in that case, you can carry on with your activities and daily activities, as well as mild exercises from mild to moderate, and then you keep on going up.
But my
And-
question is, it can happen to anybody else.
Right,
It
right.
may not be healthy to do stretch exercises or take initiative to get massage or other things. But why our medical system is so screwed up? We are, because this issue is a serious issue. You can lecture about 10 hours on muscle relaxant or other injuries. But if we don't get a treatment, proper treatment from the medical system, what good it is? So this theory is meaningless to us. We can have prevention, but we need care.
Absolutely, and that is what Canadian system is a disease care system, not a health care system. And the problem is also that the doctors, if you ask for anything, you ask, they won't give you, simply because they think they know better and they know how to deal with it. The other thing you talked about, the expired tablets, let me tell you that this is a scheme by pharmaceutical companies that the tablets expire simply in order to promote their sales. The tablets can be absolutely fine, fully effective for 10 years from the day they had come out of the pharmacy. So there is, yeah, absolutely. Yes, but only the solid tablets की बात बता रहा हूँ, और liquids they degenerate, they go off a little faster. But even antibiotics, if you keep in the fridge for 1 year, they are fine. You can liquid antibiotic, you can use it, and don't feel that it is expired. That's how it is.
Thank you.
Yeah.
She has a question. यहाँ के नल्ली बहन यहाँ के ले आएंगे
We're talking about psychotherapy. Is osteopenia or sarcopenia, is there a difference or are they similar?
No, yeah, sarcopenia is for muscle. That the loss of muscle is sarcopenia. Sarc means, it is derived from Greek language. Sarc is for muscle and penia means loss. So sarcopenia is loss of muscles. And osteopenia is loss of bone. Osteo is bone and penia is loss. So that is different. And the other thing which I was going to cover all that, but I
any other
didn't.
question?
In order to
We'll
keep-
continue with that.
No, 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 no. We can't continue. We not out of context. It should be when it is needed. So the bone is such that it is outside covering of the bone is the hardest material, which is periosteum. उसके अंदर जो है वो कई ठो tubes जैसे canals बनी होती हैं. Those are called Haversian canals, and they connect with each other, and their blood vessels goes through them, and it is a very active tissue. And what really happens that the calcium is deposited where it is needed. That's why आपको अगर exercise नहीं करेंगे तो calcium deposit which gives you the strength of the bone will not be there. So that's why, or it will not be as much as you need it. But if you need more, unless you do weight bearing exercises, the calcium deposit and hardening of bone will not happen. And if you rest most of the time, then what will happen that you will develop osteopenia, and in old age you also get what is called osteoporosis, which means that holes in the bone, but not exactly like जैसे कि आप imagine करें कि जैसा what happens that the calcium is moved out of the system, moved out of the bone by dissolution and taking it away and to deposit somewhere else if it is needed. If not, then it will be excreted and it will be gone. So that is osteoporosis, which means the bone becomes spongy. In old age, that is another big risk for the bone fracture in older age. So therefore it is important for us that we must be doing exercises which is weight bearing, and come se come walking to it is such a simple thing we can do, and such a good exercise. If you do at least 30 minutes of walking per day, if you can. आजकल के मौसम में जाना तो मुश्किल है, हम तो ट्रेडमिल पे कर लेते हैं, आधा घंटा वॉक कर लेते हैं. Then I do some weight exercises, and so it is important. If we don't do, then we will progressively get weaker and weaker, and we will have sarcopenia, osteopenia, maybe osteoporosis, and dull reflexes, and poor eyesight, poor hearing, and all this then leads to a very poor outcome in terms of managing your life and managing your health. So therefore, this is very important. Or any other question? डॉक्टर साहब आप कुछ पूछने वाले?
यस, हाँ, मैं ये पूछने वाला हूँ. मैं ये बताता हूँ कि देखिए, फॉल का जैसे इन्होंने कहा और बोन क्रैक का कहा, कोई पता नहीं चलता. मैं बिल्कुल ठीक चल रहा था, बहुत अच्छा चल रहा था, और मैं आपको ये बताता हूँ कि मैं कोई मेरी मेडिकल रिक्वायरमेंट्स हैं. मैं ये सोच रहा था कि इन स्पाइट ऑफ ऑल दिस आई लुक वेरी हेल्दी, आई डोंट फील एनी इन्फॉर्मिटी. मुझे कोई किसी किस्म की दिक्कत नहीं है. पता नहीं ये क्या घमंड था, क्या था कि उसी वक्त मेरा पाँव जो था हल्का सा टेढ़ा हुआ, हल्का सा, और इतनी चीख निकली कि मैं उसके बाद अपना कदम आगे बढ़ा ही नहीं पाया. इट इज़ 24th of November, आई स्टिल रिमेंबर द डेट. शाम को 4:45 बजे थे. मेरा हॉस्पिटल के अंदर ही थोड़ा सा पाँव ट्विस्ट किया और एकदम वो क्रैक आ गया. उसके बाद 1 महीने तक आपने देखा कि मैं लंगड़ा के चलता था, और वो सारा जो उनका इंतज़ाम था वो जो सारा किया. अभी उन्होंने फिजियोथेरेपी कही हुई है, मैं वहाँ नहीं जा पाया, ना भी गया हूँ, ना मैं कोई एक्स्ट्रा वो करता हूँ. उसके बाद अगेन बाय द ग्रेस ऑफ गॉड एवरीथिंग इज़ ओके नाउ. and I am fit, and this is what I am saying. No one knows when anything is going to happen. So ये जो इन्होंने कहा, और दूसरी बात इन्होंने स्लिप की कही, और इन्होंने कहा गिरने का और स्नो का, आप पूरा ध्यान रखिए। मैं आपको बता रहा हूँ कि आई एम सो फुली कॉन्फिडेंट कि मैं ये सोचता, क्योंकि मैं दिल्ली यूनिवर्सिटी में 8 साल बेस्ट एथलीट रहा, तो मैंने कहा ये लोग कहते हैं कि बर्फ़ के ऊपर गिर जाते हैं, कोई फ़र्क नहीं पड़ता, ना कोई गिरता है। ये तो वैसे ही कहते हैं कि मैं जी बर्फ़ पे गिर गया और मेरे बहुत ज़बरदस्त चोट लगी। बाय गॉड, एक दिन मैं जा रहा था तो वो जो वॉकवे होता है ना, उसके ऊपर उन्होंने सब क्लीन कर रखा, लेकिन वो स्नो जो थी वो शीशा बनी हुई थी और बिल्कुल उसका पता ही नहीं चल रहा था। मैंने जो पाँव रखा और वो बुरी तरह सिर के बल गिरा, और फिर मुझे पता लगा कि वाकई यहाँ लोग गिरते हैं और जो वो कहते हैं उनका विश्वास करना चाहिए। तो मैं आपका तहे दिल से अपनी तरफ से और अपने पूरे क्लब, मैंने इसीलिए आपसे पहले कहा था, मुझे पता है कि आप ज़रूर क्वेश्चन पूछते हैं। एक गेरा साहब का क्वेश्चन हमेशा ज़रूर होता है और वो बिल्कुल एक्सट्रीम पर्सनल होता है कि मेरे साथ ऐसा हुआ।
बिल्कुल ठीक कह रहे हैं
जी,
क्योंकि उस पर्सनल डिफिकल्टी में सबके भेद छुपे होते हैं, है ना। आप अपनी प्रॉब्लम बताएं तो कहीं कहीं यार ये तो मुझे भी हुआ। मेरा एक साथ, मैं 22 नवंबर 2022 में दुबई गया अपने दूसरे बेटे के बाद। आफ्टर 3 months when I came back, then when I was on the wheelchair, when I wanted to collect my baggage, I went to the baggage collection. Then I found the belt is moving like that. Then I thought I'm falling. Then I catch hold of one of the young boy's hand. He said, "Uncle, क्या बात है? मेरा हाथ क्यों पकड़?" Actually it was nothing, but I fell down. Then I went when my daughter was waiting. My grandson was there. Then at that time I could not recognize my son, grandson. Then my daughter told me कि sorry है पापा। और उसके बाद when I came, I fell down 1 or 2 times and all that. Since then I have got backache. I went for therapy also. But now if I work for a longer time, earlier I could stand for a long time, but now I cannot. So now I find giddiness. Even I am talking to you now, I feel like sitting. So what can be the reason? So what can be the reason and what should I do? That is the first treatment. You're right, that is the first treatment. So so what is the reason? And now when I talk to my family doctor, he says aging problem. Then stroke was there, my neck was ultrasound. Everything they said is okay, no problem.
आखिरी बात बताएंगे और डॉक्टर साहब की बात बताएंगे। देखिए, आपने देखा होगा डॉक्टर साहब वो पहन के चलते थे, है ना, लेकिन ये भी बात है कि हमेशा चलते ही रहे। ये नहीं कि बैठ गया मेरा फ्रैक्चर हो गया, मैं बिस्तर में लेट के आराम करूँगा, नहीं किया। That's why he got better much faster, because what happens that the remodeling of the bone and remodeling of the collagen happens along the stress lines, जहाँ स्ट्रेस के मैकेनिकल स्ट्रेस जिसके थ्रू पास होती है वहीं पे डिपॉजिट होता रहता है। द रीज़न इज़ दैट द बॉडी नोज कहाँ पे नीडेड है वहाँ पे डिपॉजिट करते हैं, एंड दैट्स व्हाई ही गॉट बेटर सो फास्ट। अच्छा, आप जो कह रहे हैं, आई डोंट नो, आई एम नॉट डायग्नोसिंग यू, बट to me it appears like that you have vertigo, and this happens as a result of malfunction in the internal ear. Internal ear में balance order होते हैं, 3 semicircular canals होती हैं, one in 3 different places, एक ऐसे रन करती, एक ऐसे रन करती, एक ऐसे horizontal रन करती है, and these semicircular canals, in addition to hearing, they are also responsible for balance. उनमें किस तरह balance होता है? There are small pellets kind of thing. Those are called otoliths, and these otoliths, they fall on these fibers जहाँ पे कि semicircular canal में होती, and that tells the brain what is the position of the body. And if that changes, that's how you change. When your posture changes, you correct it simply because of the fact that internal airway otoliths have gone to a place where the brain recognizes that it is abnormal posture and brings you back. But if what happens that those otoliths are broken off from their original place, and then they may be knocking around, and then that happens, then you feel very different, and you can also get dizzy. You can also feel that walk around, but you tend to lean on one side like this, and that's, it seems like that's what happened to you on the wheelchair.
Yes.
And
So now what is
generally what happens that it heals on its own over time, but given the older age, it may or may not, but hopefully it will. Mostly it does. अगर आप ये स्पेशलिस्ट के पास जाएंगे तो कहेंगे कि हम आपकी सर्जरी कर देते हैं. Please don't do that. Don't get it done, because two reasons that it may not be corrected entirely to your satisfaction. The second reason is that it is most likely that you will lose your hearing. So don't get it done.
Thank you. Thank you.
जी, एक बार जोरदार तालियों से मैं अपनी तरफ से और अपने पूरे क्लब की तरफ से और अपनी मैनेजमेंट की तरफ से डॉक्टर साहब का बहुत बहुत धन्यवाद करता हूं कि हमें बहुत अच्छा लगता है. ये बहुत रेगुलर है. और अभी आज इन्होंने बताया कि इनकी वाइफ रीटा जो है वो आज ठंड की वजह से कह ली कि आप अकेले जाइए, मैं नहीं जाऊंगी. तो ये बहुत अच्छी बात है कि आप सोचते हैं कि आना है. And we always feel secure when a qualified doctor is available in the club every time whenever we hold our meeting. So we are highly thankful to each and everyone who are qualified in their own fields. और जैसे जैसे लोग बताते हैं, कोई इलेक्ट्रीशियन रहा, कोई ये कोई वो, अपना हमें सभी का सहयोग मिलता है. बहुत अच्छा. और फिर बातचीत करने में हमारी बहनें हैं, जब भी बैठती हैं आपस में एक दूसरे से बातचीत करती रहती हैं, तो बहुत अच्छा लगता है. जी मन लगा रहता है. जी मन लगा रहता है, मन लगा रहता है. एक बार किसी ने कहा कि यार आज इतनी लेडीज आई और वहाँ बड़ी खामोशी रही. मैंने कहा ये तो सबसे बड़ा झूठ है. जी मैं अपनी बहनों का बहुत धन्यवाद करता हूँ, बहुत एनकरेज करती हैं, बहुत अच्छा लगता है. और अपने भाइयों का बहुत धन्यवाद करता हूँ. ये एक परिवार बन जाता है. मुझे याद है कि जब मैं अकेला घर पर बैठा रहता था, मुझे पता ही नहीं था सीनियर क्लब्स का, तो मैं अपने आप को बहुत आइसोलेटेड सा फील करता था. जब सोचता था, लोग कहते थे चलो वहाँ चले जाओ, मैं सोचता जाऊँगा मैं क्या करूँगा, मुझे तो कोई पहचानता नहीं है. अब बात ये है कि जहाँ जाते हैं वहाँ अपना घर लगता है, वहाँ अपने भाई बहन लगते हैं. जब मिलते हैं तो एकदम दिली खुशी होती है. तो मैं एक बार फिर आप सभी का इस मौसम में भी, जब चलते हुए भी डर लगता है और इतनी ठंड है, उसके बावजूद आप आए. और मैं ये कहूँगा कि आप अपने लिए एक बार जोरदार ताली बजाइए. बहुत बहुत धन्यवाद, बहुत बहुत धन्यवाद. और दूसरा ये है कि अभी हम अपना रिफ्रेशमेंट का करेंगे. और आधी रिफ्रेशमेंट तो हमने ताज़ी ले ली. भाई गरम गरम समोसे तो ले ही लो, बाद में ठंडे हो जाए तो फिर मज़ा नहीं आता. जी.